But whenever we talk about rupturing, herniated, or having a bulged disc in these lower lumbar areas and compressing nerves like L4, L5, and some of the sacral nerves, we have to have a discussion about sciatica. The term sciatica is used to describe pain that's radiating along the pathway of the sciatic nerve. And this can be caused by compressing a nerve root at L4, L5, S1, S2, and or S3. And the most common cause of this is having a bulging or herniated disc below L4 or below L5, compressing one or more of those 5 spinal levels that I just mentioned. Now, what's interesting is that many clinicians actually prefer not to use the term sciatica when discussing these issues and prefer to use a term that's a little bit more accurate called lumbar radiculopathy. Radiculo just means nerve root, pathy just means disease state or an abnormal condition. And sometimes they'll use the phrase lumbosacral radiculopathy if a lumbar and a sacral nerve root is being compressed or affected. And so the reason for these distinctions is that when you compress one of these spinal nerves through a herniated or bulging disc up in this region, the sciatic nerve hasn't even been formed yet. The sciatic nerve forms lower down in the pelvis, and it gets contributions from these 5 spinal levels. L4, L5, S1, S2, and S3 all send branches or contributions to form the sciatic nerve lower, and that sciatic nerve will emerge in the gluteal region underneath a muscle called the piriformis, and then will continue down the back of the leg. So you can see why if we're just affecting, say, the L5 spinal nerve, that's not technically compressing the sciatic nerve yet, and so that's why some prefer that distinction over just calling it sciatica, even though the pain can run down through that sciatic nerve. Now, there's 2 other things we have to cover here. One is you might think that if we had a herniated or bulging disc below L4, that it would actually affect the L4 spinal nerve. But typically it doesn't. It actually compresses and affects the L5 spinal nerve. Why in the world does that occur? The other thing that you might have been wondering or thinking, we've talked about compressing sacral spinal nerves. If you look down on the sacrum, there's no discs there. So it obviously has to occur from here or here, but how is that happening? Well, to help us understand those questions, that is a story of development while you're developing inside the cocoon of love that we call the uterus inside of mom. So this developmental story is specifically about the spinal cord, and this picture is going to help us with that story as well as help to answer the questions that we just posed. So let's orient ourselves to this picture. This is a posterior view of the lower spine. You can see the L4 vertebra, the L5 vertebra, and the sacrum, and then we've got these nerve roots coming down. The blue are the lumbar nerve roots, and the red is just representing the sacral nerve roots. I did mention this is a posterior view, so in order for us to see these nerve roots, you'd have to do some cutting. So we have a L5 vertebra to show you here. And so in order to see those nerve roots, we would have had to cut here as well as here and pull that segment of the bone off so you could see those nerve roots running through that vertebral or that spinal canal. We've even got a little makeshift cardboard disc where we've got a poor little nucleus pulposus herniating out, and we'll talk about that in just a minute. But you might be thinking, well, we're looking in the spinal or vertebral canal here. Shouldn't we see the spinal cord? And the answer is no. The spinal cord in an adult actually ends at L1, L2, right at the superior border typically of L2. In an infant or a newborn, it goes down as far as L3 and L4. But what you're seeing is that the actual spinal cord segment, say like the L5 spinal cord segment, isn't lining up with the L5 vertebra or bony segment there. Now, that wasn't always the case. When you were developing inside mom, there was a time where the L5 spinal cord segment did line up with the L5 vertebral or the bony segment there. But something occurs called differential growth. And what that means is that the vertebral column or the spine grew faster than the actual spinal cord. And so to accommodate that differential growth, these nerve roots had to grow out longer and to, again, accommodate that differential growth between the spinal cord and the actual spine itself. And so this group of nerve roots actually got a name called the cauda equina, as it resembled what they thought of a horse's tail. But this anatomy and these relationships will help us answer those questions that we posed. Remember, we said a herniation of the L4 disc that's associated with the L4 vertebra, you'd think that it would compress the L4 nerve, but I said typically that L4 nerve gets spared, and you can see from this relationship how that herniation that I've drawn here would actually affect the L5 nerve. And if I come back to this little makeshift drawing that I have here, typically the herniations are posterior lateral, so posterior and just slightly to the side, and that's how we've drawn it here, as well as down here. The disc that's associated with the L5 vertebra, or below it, you can see how it would spare the L5 nerve, but compress the sacral nerve, and that answers our second question, how can you have sacral nerve issues when there's no discs to herniate in the actual sacrum? Now, some of you might be taking this even further, thinking, well, what if that herniation was even greater or larger or just even more central? And you could see if we just moved it slightly more medial or had more of a central herniation, you could affect even more of those sacral nerves. So hopefully this picture can kind of give you that idea, is at least give you that visual, how you can affect certain nerves, spare other nerves, and even affect more sacral nerves than you might actually anticipate, with no discs actually being in the sacrum.